like we're getting a few more people on, but I want to go ahead and get started to optimize your guys' time. I guess I'm just going to go ahead and start the slides. Is this anybody's first time at a study session? You can use the chat, you can use the hand raise, you can come on camera. Okay, looks like it's nobody's first. Fantastic, thank you. This is someone's second time. All right.
All right, Mel, while you're setting that up, I'll ask the next question unless it's part of your presentation. Who is on today that is registered to write the exam? Put up your hand or put me in the chat or whatever.
I am.
Okay, excellent.
I am as well. I just haven't received the okay yet.
Okay, excellent. Just to let you all know, though, these sessions, if you are unable to attend one, they are being recorded and will be available in FQA Connect with the group that we have for individuals writing the exams. So if you missed the first session, you can go and look at that one. If you missed Melanie's great discussion about the
test-taking strategies,
psychology behind writing these exams, you can also take a listen to that hopefully should add some help in terms of writing. So now
psychology is such a fancy way of saying it. It's really just test-taking strategies. Yeah. Okay, so you should be able to see my screen right about now.
Yep, I can see it.
Yay, me and technology, we're getting along. There are a few of us on here. It looks like Sherry Lee, me, and Hector. I think that's all the faculty at the moment. But this is an open discussion, right? So this is for your benefit. Hoping you guys brought questions. I kind of put that in the messaging from last week to bring questions. If you didn't, no problem. If you have some, let's talk about them. And then we'll do that again probably next week as well. Each week we want you to bring your questions. So as you're going through, if there's something that seems something that you would want more information on, or that you think you could benefit with an open discussion on, because hey, maybe you've done different type of work than maybe others have, please bring those questions. What I'm going to start with was just some housekeeping. So now that we have a few more people on, please raise your hand if this is your first time on, because I'll go through this a lot slower if there are somebody so that we have all the housekeeping items. Otherwise, it's very repetitive from previous from the one Sherry Lee hosted. So anybody not at Sherry Lee's hosted study session. Ooh, we got committed people. All right. All right, then without further ado, this is not an updated schedule. It's a picture. So Sherry, if you have updated ones, we may need to get that. Okay. So exam writing and or in other terms, like I always know it as exam taking. You're taking the exam. These are just some logistics, good to know, and helpful hints. Again, this is just a repeat. So if anybody wants me to bypass this, please let me know. But just a reminder, there is 165 questions. 15 of them are like trial questions for SQA, as they're getting to test how well they'll work in the exam. So they won't be scored at all. However, you won't know which ones are which. So you'll treat them all the same. You will have 3.5 hours to conduct your exam, which kind of averages out to 1.5 minutes per question, but focusing on just that can cause a lot of stress. So keep that in mind. But it does mean, you may have to speed up your process. If English is not your first language, there is special testing for candidates who are not native English speakers. It is an extra cost. I do not know what the cost is. The practice exam is now free. We encourage you to take it as many times as you want. It will stop you at 3 times. So after you've taken it 3 times, it won't automatically let you go again. You do have full access to do so. All you have to do is contact Lydia or someone in headquarters to reset it for you. The exam covers FDA, EPA, and OECD principles regarding good laboratory practices, as well as 21 CFR Part 11, electronic signatures, access, all that fun jazz. Please feel free to stop me if any of this is new and you want to talk about it. We have here listed out the specific OECD principle number documents, which you should have access to, both from OECD as well as on the SQA website. We suggest you read everything in the candidate handbook. It does give you a nice guidance through the whole process. It also kind of breaks down the way that we are doing these these study sessions. So they're named very similarly. We go over similar topics. Common sense says know your regulations. The preambles for the FDA, wow, I can talk. The FDA GLPs are also incredibly helpful to understand the mindset of the commissioner when they were writing this, which also helps drive why the GLPs are in place and will help you on this exam as well. Answer your questions based on the most conservative approach to the regulations. So while it's important to know what you and your company do, your experiences, remember that the exam is listed and written in a way towards just the regulations and not to industry practices that you may have seen. So keep the conservative approach. This is a repetitive that lots of questions, not necessarily a lot of time, but it'll feel like you're spending your entire day doing it, right? Read through the questions carefully. If a question looks really long or complicated, it's okay to skip, or if you've read through it and you're not quite certain, it's okay to skip and come back. They do flag it to make it easier. You don't have to like search through it. And then keep an eye on your time. After the first hour, you should be about through 50 to 55 questions to pace yourself if you are answering every question. Now, remember, if you're passing through questions, that may change things. This is just estimates for a way of doing it. If you're unsure of a question and you're at the end, it's better to guess and put an answer in than to have no answer at all. No answer at all, you'll definitely get it wrong. If you guess and you've put a best guess, you have a much higher chance of, at minimum, a 1 in 4 chance of getting it right. 1 in 4, 1 in 5. I think some of the questions are 5 questions. Keep an eye on key terms. We'll actually talk a little bit about this through some of the next discussions, but they'll help you determine like which regulations are being talked about, whether you're talking EPA versus FDA, whether you're talking US regulations versus OECD. Here's a few examples: protocol versus study plan. You have access to these, so I'm not going to read this to you. Apply logic as much as you can. That's the GLPs are basically a type of logic. And then this is kind of talking about looking for the 2 questions that are clearly incorrect. This is about using deduction and induction reasoning to filter down the multiple choice answers to get to the one you need. Hi, Laura. Looks like you. Nice to see you. Thank you for letting us know you're here. All right. Any questions on the logistics part?
Yes, I have a question. For example, if there is like a 2 final answer and one of them, it's not wrong, but it's a better choice. Both of them, one of them would be better choice, but not wrong. Will you consider like if I choose not the best of the best, but the better choice, would the score be split, or is it like absolute? Okay.
Yeah. They're looking only for the best answer.
Okay. Thank you.
Okay, so this section, oh, sorry, anybody else? I don't want to rush you guys. This is your session, not mine. So this study session, we're kind of focusing on monitoring and what to monitor. This comes straight out of the candidate handbook, so nothing should be a surprise unless you haven't read it. Then hopefully it's still not much of a surprise, but a little bit more new to you. This section's about the receipt and handling, storage preparations, so the test system, as well as test article, materials and reference materials. That it goes from all the way from test systems for receipt and quarantine, all the way through disposition, so all the parts and pieces. Specimen and or sample collection as well, handling, labeling, the whole process of taking samples through. All the way through analysis, and then reagent and supply, shipping, receiving, handling, all of the things that you can get and ship. That's pretty much what we're talking about in some way, shape, or form here, as well as adhering to your protocol as specified. Your protocol, as well as your SOPs and applicable policies, how to follow those through. Data collection processes are monitored for not just did you collect it, but will it last, right? Data integrity, equipment maintenance and calibration, anything that's supporting, you got to monitor all the stuff that supports the collection of your data and maintenance of your data. And then archival. So really monitoring, saying monitor the whole shebang, which again, not a shock to you guys. Also consider laboratory facilities or activities that support your GLP activities, vendor management type ideas. So I gave y'all homework last week, and I'm hoping somebody did some homework and came up with some questions while they were doing their studies that they would like to bring to the team. Is it too scary? You can put it in the chat if you have questions.
Yes, I do. For example, when you, I still wonder, is it an after subject, but it's just a question. When you support the dose formulation analysis, right? Will the method need to be validated?
It's a good question. Does anyone want to try and give it a stab at the answer that they would use? Break this down. Why would you or why wouldn't you validate it? You guys there? I don't want to, this isn't just about me spewing information. I want you guys to be able to start talking with each other. This is a healthy study group. So I'll start prompting some more.
Can someone maybe repeat the question or type it in the chat? I'm not sure I caught it all.
Oh yeah, sure. Okay, so Sherry, if you could type it, I'll repeat it.
Melanie, you don't want like Sherry and I to answer, right? We're here for
You can. Open discussion. I do want, like, I mean, I think we want anybody to participate. Ideally, the faculty will help support.
Gotcha.
And it looks like Rebecca says, yes, I'd love to hear the question again. But Sherry or Laura, if one of you could type the question after I repeat it, that'd be appreciated.
I'll type it.
Thank you. The question was, when monitoring dose formulation analysis, does the method for dose formulation analysis need to be validated? Is that correct?
Yes.
That was a
Perfect.
question.
Thank you.
So that's a fantastic question. If you're looking at it in the chat, let's break it down. One, what topic are we talking about? Dose formulation analysis. Two, the key part of that question is, does it need to be validated? So if you're breaking down a question when you're doing the exam, those are the two things you'll highlight. whether that's electronically or in your brain or however, right? Dose formulation analysis validated, method validation. So the question is, does it need to be validated? What is the point of validation?
I would think, yes, it does need to be validated because you need to make sure that it's actually capturing what it says it's going to be capturing.
Yeah, so the point of a validation is to confirm the accuracy of the method. So you want to know that whatever comes out at the end is accurate, which is, I think I'm just rephrasing. And I'm sorry, is that Michelle Herrera? I can't.
It's
remember your
Myra.
first name. Myra, I'm sorry. I
No
will
worries.
get these. So that's, I think what Myra, you're trying to get at was that it's about, the validation is about accuracy.
Yes.
Accuracy, precision, all of that, where you want to know that method is useful. So where do you find that in the regulations? Now that everyone's on board with the answer of yes, but why? Anyone? Let me get this pulled up. Give me a second to find the exact verbiage. Or if any of the faculty has already gotten to that while I was talking, please feel free to start saying it specifically.
I would go with 58.81A SOPs. If we're talking FDA, we're talking OECD, whole other thing. If we're talking there, a testing facility shall have standard operating procedures in writing, setting forth non-clinical laboratory study methods that management is satisfied are adequate to ensure the quality and integrity of the data generated in the course of a study. So if there hasn't been a check on the method, how does management know that it's adequate?
The other section you could go for would be 58.113. Yep, thank you, Rebecca. That's speaking as I say it. Look at, she's faster with her fingers than I am with my mouth. Okay. For 113, for each test or control article that is mixed with the carrier, dose formulation, test by appropriate analytical methods shall be conducted. Does the word validation show up here? No. So what is consistent about that verbiage that goes towards validation is the word appropriate. How do you know it's appropriate if you don't validate it? So the word validation isn't specifically listed out, Han, but it is in this, the concept is there, so it's just different terminology.
Okay.
The likelihood that the exam will use the word validated, I don't know the answer to that.
Okay. Thank you.
That's a great question.
Yeah.
Starting us off strong. Anybody else do their homework? Okay. While y'all think about maybe pulling out the homework that you may or may have not done, or more questions that you've been hiding in your pocket, I will move to the next slide for, so I did the homework too. Well, Sherry and I did. Give Sherry the credit. She did 2 of these and I did 1. We prepared some additional questions. We're starting with Sherry's. Ha ha ha. Okay. For specimen labeling, what should be included on the labels? So starting with like taking the question and piecing it apart, what are their key terms? There are 2.
Specimen.
Yep.
Labeling.
Yep. Specimen and label.
Yeah.
Really basic, but it's important because sometimes when we're thinking quickly and we're looking at labels, we're thinking, and we just read a question about test article characterization, it's very easy for our brains to skip over the whole word specimen. All right. We have some answers already coming. Great job, guys. So expiration and lot number of a specimen. I'm not 100% certain where we're going with that, but maybe of the solution that's in there potentially. Like if you have like a fixative or something. Let's see, we see name, storage conditions. What do you mean by name when you say specimen name?
You mean identification?
Yeah, identification. Okay. Species. Species would be a good one. Okay. All right, now that we've got, I like that, like pretty consistently, you guys are like storage conditions. Yeah, love it. Okay, where in your regulations, and you can pick any of the regulations. I just happen to have in my hand FDA because that's what I primarily work with. But if you use OECD, we got any OECDers? Raise their hands. Just Sherry. Oh, Sherry, well, then we're going to lean heavily on you to help us find these sections in OECD since I don't have that pulled up. I do some OECD, but if you do it on a regular basis, we'll ask you, Sherry, to help us with that. So for the sections and the regulations, who's doing EPA? Anybody? Okay. EPA regulations are very similar to the FDA. You'll probably find them in very similar sections in my experience. Not always. All right. Okay, Ashton, you're our EPAer. So let's look into where specifically is listed what specimen labeling should have on their labels. I love Sherry's thinking face. And if anyone gets it, the FDA or EPA or OECD before any of the people I just said, all right. Rebecca says 160, 130. I'd have to pull that money. I think that's an EPA number. So Ashton, is that consistent? Are you in alignment? Laura's nodding.
I'm pulling it up now.
Put pressure on everybody, right? This is good, guys. This is very good. You guys are doing this.
I have a really good side by side of FDA with the two EPA regs with the differences highlighted in one neat little book, if that would be helpful to anyone.
Yeah, the reference material that they have actually has OECD, FDA, and EPA.
Perfect.
Someone listed 58107 for FDA. I think that's still for test article. We're looking for specimens.
The EPA reference is correct.
Now here's your cheater.
130C.
Perfect. Good job. Good job, both Ashton and Rebecca. Sherry's got the OECD. So for FDA, here's a little cheater now that you know what the EPA one is. Go check that same section. So instead of it being 160, change it to 58.130C. We've got a few people looking it up. Anyways, that will be your section. And so it lists, and well, I see test system, study, nature, and date of collection shall be identified on every specimen.
I'm so sorry.
Go ahead, Laura. Oh. So what does nature mean? Because if the exam gives you an example of here's a label, and I don't know that the exam well, this is just me making stuff up, okay? If they show you a label, like, would you know that it has all these things? What does nature mean? And I'm not meaning go outside and stand with the trees. Okay, so this could be something as simple. Oh yeah, we going. Composition. Maybe dependent. Yeah, I guess it depends on what type of sample. So type of study would not be something. So you already are listing like the study number on your sample, but you wouldn't like list necessarily like the full type of study, right? Lots of times that label's pretty small. So nature has less to do about the study and more to do about the nature of the specimen. So composition could be like, if you definitely that a bit of a vague term when it comes to all types of specimens, but yeah, what's in there? If it's a tissue, do you have a liver? Do you have is it blood? Is it blood? And if it's blood, are we talking heparinized blood? Is it K2 EDTA, K3 EDTA? Are we talking frozen, flash frozen toes? What's in there? I don't know that I've ever seen anyone collect just toes, but it's possible. All right. I think we've exhausted this question. I will put the next one. I'm leaving the other questions up there on purpose this time. So if anybody wants to go back while their brain is still stewing through all these silly things that Melanie has been saying, please feel free to bring them back up. When performing audits, study-based, process-based, and/or facility-based, what key documents should be utilized when auditing the activities? All right, so what's the first thing you're going to do when you read a question like this? Sorry. I'm not sure why that did that. Uh-oh. It's after lunch. For some of us, are some of you guys food comaing? Rebecca's on par. Lau's kicking up. Oh, you guys were just faster on the type. I got it. SOPs, protocol, regulations. Yep. Boom, bam, boom. You guys just went straight to the answer. Okay. Well, that was easy. What if I had an analytical method? In what bucket does that fit into what you guys just listed? Because you guys listed all three that are absolutely, but an analytical method is what? As far as FDA is concerned. And Sherry kind of mentioned it earlier. Yeah, Lau, got it. Yep. Yes, love it. All right, get your reading glasses on if you have them. If not, lucky you. Here's the long one. I don't love my voice enough to read this to you. Unless one of you raises your hand and says you can't see it. Okay, I'm going to assume you all have read. So I'm going to start with just the yes or no question. Did the technician ensure compliance with 21 CFR 58 and OECD principles? If you think the answer is yes, put a thumbs up, use an emoji, positive emoji. If you think no, thank you, Mira has said no. Also, Amor has says no. I feel like that might be not, it's like A might be your first initial. Oh, resounding no's across the board. Okay, why? Amor says each file should be labeled and identified. Does everyone agree with this? Yeah, agrees. Love it. All right, why? Dun, dun, dun. Where in the regulations? Or if you don't want to find it in the regulations because you're like, I'm not sifting through it, I know this is true. Tell me why. What's the reasoning that they want every single file to be labeled? In case they get mixed up? Yeah. In case they are removed or separated? Absolutely. Yep. Do you think that every dose comes directly out of the refrigerator? Right? If they're in or in storage container, they have to get it to the animal at some point, or the test system. Maybe it's not an animal, maybe it's a human on a chip. Right? So at some point, it's not going to be in that secondary container. Okay. So those were my main questions that we had prepared. Anybody want to go back to the just participants questions? Yeah. Oh yeah, I forgot. Sorry. Thank you, Sherry. There's the section. So if FDA's section is 58105C, my EPA friends, what is the 160 section?
160, 105.
I love that EPA and FDA did that. Makes it so much easier.
Yep. See, yeah.
Fantastic, Lau and Han. All right, OECDers, or those who have OECD sitting open on their desk. It's like a scavenger hunt, isn't it? How fast can you find it? The faster we do it, the less annoying Melanie will be. Sherry's like, shut up. Okay, section 2, 6.1, I think it's another 0.3. Thank you. But I don't know if this chat is retained. So if you're sitting in and you're not taking notes, feel free to use this again and be like, oh, I'm listening to Crazy Melanie ask her questions and looking at the slides, and hey, I'm going to try again and try and search for them. Right.
Melanie, I don't remember when I took my exam a couple of decades ago. Are test participants allowed to bring reference materials like OECD booklet or FDA booklet? No? Okay. All right. Just checking.
No, but it's a really, so I'm recommending finding it in the regs now because you guys are all practicing and learning and trying to remember all of this. And from my session last week, I learned a lot of y'all are visual learners, which is why I am adapting to make sure I'm talking about what you can see, since a good chunk of the people that came to that session said they're visual learners. If you're not a visual learner, that's why I'm talking and saying all these things and repeating everything that's written. If you're tactile, I can't control your body, so that's on you, to stand up and move while you do this. Okay. Well, if you guys don't have any questions, then it kind of moves into the, yes. Rebecca has one. I am at a FDA GLP test site for Tusca. Do you mean? Oh, okay, sorry. For a test site for Tusca and FERFA GLP EPA, can someone describe what is the difference between control and reference substance and how exactly they are used or administered? Before I answer or necessarily any faculty, does anybody want to take a crack at that? I know Ashton's does EPA work, but I don't think you do much with control and reference substances from my remembrance of working with you.
That's correct.
Anybody else? Any faculty want to crack at it? Because I don't need to hear my voice. Ooh, Lau says, control is for verification that your reference is okay. Looks like Laura wants to say something.
I was going to say in a GLP study, your control article is something that you are using as a basis of comparison to your test article.
Yeah. And a reference is often going to be when you're then testing your results or testing your formulations. That's what you use to make sure that your reference substance is kind of like your baseline. Baseline's a wrong term, but
a lot of people get very confused as well with a vehicle versus a control, and they're not often the same thing. So that's a whole nother.
They can be though. They can be. It depends on how. Yep.
But you can also have a study where you've got a vehicle, a control, and a test article.
Yes. So let's talk about that. Yeah.
So
Wow.
it's
Thank you.
very
Reference can also be used as a
important
calibration. So what is a vehicle? Let's define vehicle. Laura, do you want to go ahead and define a vehicle before move to next?
Sure. A vehicle is just something, well, gosh, I'm not going to do this very technical, you guys. But a vehicle is something that is used to carry the test article. So your test article is agent X, and you might need to place it in sterile saline to administer it to your animal. That would be a vehicle. Then if you're giving that sterile saline to your group 1 or control group and doing statistics to analyze or to compare against your animal groups that were given test article, then it would also be a control article.
But your control article could also be the vehicle plus another item. So if you have a complex test article and it's got compound A and compound B in vehicle saline, you may find that compound B was already tested and is considered a predicate drug or test article or whatever, or drug out in the market, if we're talking pharmaceuticals. And so that might be your control is actually compound B in saline. And so you'll have all three when you go into formulations. They might all be separate. They have to be put together. A reference, yeah, I mean, the Lau's little statement of it can be a calibration is pretty much right on point. It's kind of your pull that you come back to, your home base. Okay. Thank you, Rebecca. That was a fantastic question.
Would control will be able to use in EPA and FDA term?
Yes.
It can
Control
be
is
used
pretty much across the board.
Okay.
Yep.
The difference you're going to hear is substance.
Yeah.
So if you hear control or test substance, which regulations are we thinking of?
EPA.
Yes. If
Drug
you
substance.
hear, so here's a fun one. Anybody do med device?
I used to.
Okay, yeah, me too. I love med device. Okay, so what if you hear test device, which I'm not certain, other faculty let me know. I'm not certain that that's actually seen on the exam, but if it is, I'm prepping
I
you
don't
for it.
remember. Yeah, I don't recall. Yeah, coming across that term.
In a
Yeah,
long time, I don't recall either.
Um,
I took it about 5 years ago, guys, and if I remember correctly, med device was not strongly represented in the exam.
right.
Like
Yeah.
the nuances of it. So you probably won't see this. However, there have been new exam questions and they are testing exam questions. So if you see test device or control device, it could be any of them because it's not an actual regulated term. They're all either articles or substances.
And
Yeah,
and
I
then
had
you'll come across the word item for OECD
Thank you. Yes.
terms. Yeah.
Yeah, thank you for that. I actually had a coworker who took the test last year, and she said that she didn't find any medical device questions on the test. So she's currently writing some questions for the test that will include medical device. I don't know if her questions will get chosen, but when she took it, I think whatever the last test period was, I don't remember when that was. She didn't find any medical device questions. In our facility, we do medical device.
Mm.
Yep. And it's funny because when I started med device too, and it's the same, not in there. So just remember, anytime you think of device, just change it to article or substance or item. All right. Anybody else have a fun question? Faculty, you're welcome to bring some in if you have ones. Otherwise, we're going to go into the practice exam questions.
So I will go with one that I remembered when I studied over and over, and I saw it so many times in the letters to the EPA. So there were many requests to the EPA asking, how long must I retain the containers, the test article, test item, test substance was held in? So how long must you retain the containers for?
It's a good one. This is valid for FDA too, and OECD.
Yep.
Yes. Took me a second.
Will the information retaining or disposal be captured in the SOP or in the protocol? Or we have to
You
go
could
for
have it in there,
Yeah.
but there is also minimum requirements in the regulations.
Okay.
Okay, Sunita
2
came up with
years? Just
2
guessing.
years. You're
Yeah.
saying 2 years? Okay. I see shelf life until the submission. Ooh, what submission? That can be tricky too, because you might be doing multiple types of submissions. 5 years, 4 weeks. This is a good one, Sherry.
Thank you.
Okay. So let's start with the why. Why would you retain the container?
Give you a hint, it's in the preamble.
So Mira, you referenced 58105. I'm assuming you're 105D. I would recommend, I'm going to read it back out Oh, Sherry says C. Yep. So I think people are thinking of the question you asked in two different ways, Sherry. One, people are thinking about retaining reserve samples, and another thinking about the container. Those are two separate things. So say I have a container and going on study versus I am retaining samples that can then reserve samples that will then be potentially used to analyze after the study. So we are not talking about the reserve samples.
And just for an FYI, it can be helpful to have that FDA, OECD, EPA document. And then you can do a search and it comes up to, often there's a lot of the same word, but if you do container, there's 14 entries of it, but it'll come up to the labeling and storage container for articles. And that'll highlight what the requirement is.
So I think Ashton's answering the question I said about the why. Why would you retain a container? Yep. So I think we've gotten good interaction. I'm going to go ahead until test is completed. What test? Wow. Like dose formulation test, the entire study, what test? The time point. Okay. So actually it is the whole study. I think somebody, oh no, maybe not.
And
It
there
does
actually
say,
isn't, sorry, there isn't a requirement under OECD principles of GLP. It's only an FDA or EPA.
so in US regulations, it states blah, 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 blah. See, it has a whole bunch of stuff, but at the very last sentence, it says storage container shall be assigned to a particular test article for the duration of the study. Why do we care? Ashton's got further down the road would be study reconstruction. You have no idea what container was in. Yeah, I'm going to tell you a story. This is a real story that happened to someone I know at another facility. My friend, I think is how Judy Zahor always says it. My friend had this occur. So retain this test articles and control articles came in vials like this. And they were single-use vials. You still have to retain them for the duration of the study. So they went and they dosed the animals and they stuck them back into their containers and retained them for a duration. But it wasn't for the whole study. So they got everything done and they thought, we're keeping the big containers that all the vials were in, secondary container, but we're not keeping all the individual ones. So they didn't. They inconsistently retained them. And at the end of the study, they were doing their toxicology analyses of the tissues, and a couple animals came back, control animals came back a little odd. Looked like they got test article. So what they would have been able to do at that point was go back and look at what was dosed, what was in the containers, and whatnot. Luckily for them, they did retain a few, and just the key ones that were necessary. They took a control vial that these animals were dosed with. They then tested the residue that was left in them and found that, whoops, test article had been placed at manufacturing into the control vials. And it was during a time point that was not being tested. So after extensive evaluation, they were able to confirm. So that is one example of when that was super helpful to know what happened. reconstruction. Hopefully that never happens to anybody ever again.
I will add though, based on all the letters, and I just remember it vividly. So it's been a number of years, but with EPA, obviously a lot of the test substance can be retained in like tankers and stuff like that. So this is why there was an excessive number of letters to the EPA, and often they would ask for a pass to get rid of the storage container. So with written approval from EPA, you can get out of it, but you need to have the authorization with a justifiable reason. So there were many letters that talked to, you know, it's a year-long testing or a 6-month testing, and they have tankers lining up, and they're just frankly running out of space for these tankers of the test substance. So absolutely, you know, there are exceptions to the rule, but not specifically in the regulations. You have to essentially ask for approval.
And Laura, you want to go ahead and read us the section of 1987 preamble? I'm presuming you have it up. That's
I do. I actually use that all the time because we're really big now on the why in educating staff. It says, so people questioned, why is this necessary? And, oh, sorry, it's gone. Hold on. Okay. They said that the agency recognizes that it may be inconvenient for laboratories, especially small labs, to devote space to test article containers, which is emptied before a study is completely terminated, discontinued, or which might be replaced by progressively smaller containers during study progress. Destroying or reusing or otherwise substituting for originally assigned identified test article storage containers, however, could adversely affect the integrity of the study. FDA established these current provisions because the agency observed a lack of accountability for test materials due to the very acts prescribed in the regulation, such as transfer of test articles to different size containers and destruction of empty containers during the progress of the study. They believe that the requirement is necessary to ensure the integrity, simply because the act of transferring the test article from one container to another introduces possibility for contamination, or like you said in your example, putting the wrong thing in the wrong files, or mix-ups with other materials. In addition, during the transfer, the test article would be exposed to airborne contaminants as well as moisture, either which may compromise the integrity. So yeah, so basically they just want to make sure that if there is an issue, in Melanie's example, that they can go back and verify or see what happened. That's it.
Thank you. That was a fantastic question. Thank you, Sherry. We are down to the last 7 minutes. So I am going to switch to this question solely so that we can, oh, actually, we didn't keep we did solely so we can talk about induction versus deduction, since I know several of you were on the call last week, Wednesday, and asked about this. Oh, sorry, what's the answer? Duration of the study, Sunitha. Okay, so this is one of the sample questions that's on your practice exam. So if you had this question, how would you narrow down to 2? If you were doing, does anybody know if they're an induction versus deduction learner? And I'm only doing this because we only have 6 minutes, and several of you are on there and it came up. So unless you guys say, don't do it, I'll keep going. Induction versus deduction learners.
I'm sorry, I don't know what the question mean. What does that mean?
And then the answer is you don't know, and that's totally fine. So that's a good answer. It's okay. So when you're looking at a question like this, and you've read your question and you've highlighted the key terms, and you're coming down to A, B, C, or D, deduction means you're going to go ahead and eliminate the wrong question, the wrong answer. So the question is, a study protocol requires body weights to be determined twice each week. 2 technicians work together. A technician weighs the animals and another technician records the weights. The study director observes the process. Who should be identified on the data sheets? So if you're a deduction learner, you look at here and say, okay, well, I don't think it will be just this person. I don't think it's going to be just one person. So I know that then I can remove A and D because it's going to be, oh, actually, okay. Anyways, so you know, some sort of deduction, you know, okay, well, study director's not doing anything. So I know I can remove the study director. If you can't tell, I'm an induction thinker, so it's taking me a second. And so you remove the ones that you're like, that can't be right. So think with a deduction person, you would take out C and D is the first 2 you would take out. For an induction thinker, you think of the ones that that have to be included at minimum. So you start with, well, of course, the person who is putting pen to paper needs to be on there. So you say it has to be C and it has to be B. Right, those have to be included because the person who's putting pen to paper. Or maybe you think, you know, it has to be the person who's doing the actual conduct. So that's how you kind of narrow it down. Induction would include the people. So it would have to be this or this. Which one's better? Oh, most of you are deduction thinkers. That's this common way. Yes, and the answer is B. Very good. So does that make sense with induction and deduction? If you're a deduction learner, go ahead and say, well, I know it can't be this. I know it can't have this person in there only, or it can't be just one person. So I'm going to knock out anything that's just one person. Or if the answer was, you know, turned around and it was all done by one person and there was a whole bunch of extraneous people, you're like, well, I know it's only one person. So I'm just removing, it can't be the ones that have multiple people. Things like that. Hopefully that's helpful. With 2 minutes to spare. Oh, go ahead, hon. I saw you come off.
Yes. Can you send me the preamble for the information today? You know, for example, will be preamble also apply for EPA or only FDA have the preamble?
I think only FDA.
Okay.
I mean, faculty,
Yeah.
am I wrong?
I am only aware of the FDA.
Me
Okay.
too, but it would
All
make
right.
sense they would have one for EPA,
Yeah.
but I'm not aware of it.
All
They
right.
have different processes, so I wouldn't be
Yeah.
surprised if they're
Right.
not the same.
Can you be able to send me a link, or it already in the website, you know, for the SQA? Oh,
Here's the
thank
link
you.
to the
Thank you.
1987 one.
Yeah.
So there are 2, Han, just
Yeah,
so you're aware. There's a 1987 and a 1976.
78.
78.
78.
Yep.
That's
If
interesting.
ever, just as a reminder that if you go to the SQA website, so sqa.org, under education and career, you
Yeah.
have the RQAP credential, and from there, they actually have RQAP candidate resources. So
Yes.
from there, you can click on that and you'll get the RQAP-GLP examination study references, and it lists all of the ones that are available. So it's got the advisory policies, the preambles, the FDA, the OECD, everything is all there. The Q&As from OECD, from
I think
FDA.
the only thing that's not there is that comparison chart, which would be nice if we could get that up there.
I thought it was.
I did too, but last week I went to look for it on there to make sure and I didn't see it. But then you gave it to everybody.
Okay.
So we'll put that back in the chat, not in the chat, the discussion on SQA Connect one more time, the comparison chart. Now, while we work on getting that updated onto the SQA website. Does that sound fair to everybody? Okay. Okie dokie.
That would be so awesome. Thank you.
No problem. Happy to help. Okay,
Yeah.
so for next week, Sherry, I don't know who the moderator is, but I'm going to prep them. Hey, y'all, please bring questions like Han did. Han, continue to bring your questions. It really is more beneficial to you to have questions from your practicing and going through and looking through and remembering. I think Rebecca also came with a question. Thank you both for doing so. Please do bring them to the next session. I will not be there. I will be there in spirit with you guys. Feel free to reach out to any of the faculty if you have questions. Use the team chat. I am going to try and put fun random spark questions if I can remember. Sherry, get on me if not. Oh, you're on vacation. Laura, remind me to do this. Let's put some spark questions into the chat. And Laura, are you doing it next week?
Yep.
Is that what you're saying?
Yep.
I'll be with you in spirit.
Brandon is moderating.
Okay.
Yeah, I'm
So,
jumping off
yep.
now though for another call, but I'll see you next
Yep.
week.
All right, guys. Thanks so
Right.
much. Good job.
All
Good
right.
luck.
Thank you. Bye-bye.